So welcome everybody, and thank you for being a part of this important event. My name is Dan CHERKIN, and I've been the co-chair of the planning committee for this workshop, along with my friend Tony DELITTO, who will say a few things in a moment. This meeting is being convened under the auspices of the National Academies of Science, Engineering and Medicine's Forum on Neuroscience and Nervous System Disorders, and Global Forum on Innovation in Health Professional Education. The meeting was organized by an ad hoc planning committee, and both speaker and planning committee biographies are available in handouts provided at the registration table. A proceedings document of the presentations and discussions from the workshop will be prepared to reflect what transpired at the workshop. It will be published by the National Academies Press and made broadly available to the public. All views presented in the report will be those of workshop participants, and the report will not contain findings or recommendations. Let's see. We are grateful to the substantial contributions of the diverse and devoted members of our planning committee for creating the excellent program you are about to experience. Please join me in thanking the planning committee for their service. So there's many objectives of this workshop, but quickly review it's to bring experts together and key stakeholders to discuss non-pharmacological approaches and integrative health models for pain management. The objectives include reviewing the current evidence for the effectiveness of non-pharmacological treatments and integrative health models for pain management, as well as available evidence on use patterns and patient interest. To explore the state of evidence on the effectiveness of emerging models of pain management, to consider multimodal approaches and potential synergies between and among pharmacological and non-pharmacological approaches to pain management, and between and among devices and non-pharmacological approaches to pain management. To discuss research gaps and key questions for future research, to examine health professions' current approaches for educating students, trainees, and practicing clinicians on non-pharmacological pain management, and discuss potential next steps to improve training and education within and across health professions. And finally, to explore policies that would enable broader dissemination and implementation of evidence-based non-pharmacological treatments when appropriate. The workshop is divided into 4 sessions. The first session will focus on the evidence on effectiveness and safety and emerging models of care for non-pharmacological approaches to pain management. The second session will focus on education and training of health professionals in pain management. The third session will move to policies to promote evidence-based non-pharmacological approaches, and will conclude with a wrap-up summarizing what we've heard and looking toward the future. Before we begin, I would like to share some thoughts about why I believe this workshop is so important and why I'm so grateful to the National Academies for sponsoring it or hosting it. I recently retired after spending over 30 years conducting research focused on improving care for low back pain. When I started, there was very little solid evidence to inform clinicians and patients of the best ways of thinking about and responding to pain, to back pain in my case. I'm happy to report that we have since learned a lot and now understand many ways to improve care for pain. Unfortunately, despite the availability of this new knowledge, there is still a large gap between what is known and what is practiced. The ongoing crisis of opioid addictions and deaths created a sense of urgency for rethinking how pain is managed in this country, and has resulted in much greater attention to the problem of pain. A revolution in thinking is occurring. For example, the recent publication of the American College of Physicians guidelines for back pain that recommends that non-pharmacological treatments as a first-line care represents a dramatic change from the past, where prescriptions, drugs, including prescription medications, were first-line treatment. The challenge now is to find strategies to effectively and efficiently implement non-pharmacological care into real-world practices. I believe the speakers you hear over the next 2 days will provide a compelling rationale for incorporating non-pharmacological approaches into pain management practices, and will identify the research, training and education, and policy initiatives that will be necessary for this transformation in care to flourish. It is now my pleasure to introduce my much appreciated co-chair, Dr. Tony DeLitto, who will take us to the next step.
Thanks, Dan. Again, it's an honor to be here. It's an honor to be included with this esteemed group of people that are going to be talking in the next 2 days. There's some additional items. Housekeeping. Note that this workshop is being webcast. There are 2 Twitter hashtags for the workshop, hashtag Neuroforum and hashtag IHPEGF. And when you're for the audience, when you're asking questions or providing comments, please speak into a microphone. There are standing mics around the room, and introduce yourself first. My own remarks are going to be very brief because I want to keep us on schedule. This is one of the things we talked about in every single one of our conference calls. I'm with Dan. I was trained as a trialist. I did a lot of work in comparative effectiveness and non-pharmacological treatments. And about a year ago, I decided I wasn't going to do that anymore. I wasn't going to. I think the goal that I have for the little career I have left in front of me is to implement what we know. Because I think if we implement what we know, I think we'll make a big dent in the problems that we have in pain management.